Hello friends, today you are going to learn first cervical vertebra. It is also known as the atlas because it supports the globe of the head. The mythical giant who supports the pillar of heaven. It is unique in that it has neither a body nor a spinous process. It is ring-shaped, consists of pair of lateral mass connected by a short anterior arch and long posterior arch. And laterally there is a presence of the transverse process. Now we see the anterior arch. Anterior arch on its anterior aspect is marked by a median anterior tubercle and posteriorly by there is a facet, oval or shaped facet, that is for the odontoid process of the axis vertebra, and it's forming the median atlanto-axial joint, that is a pivot variety of synovial joint like this way. So this one is a odontoid process and this one is a posterior surface of the atlas. Then we see the posterior arch, that's forming the 2/5 part of the ring, and it corresponds with the lamina of the other cervical vertebra. Its posterior surface is marked by a median posterior tubercle which represents as its large spine, and this permits the backward nodding of the head at atlanto-occipital joint. The upper surface of the posterior arch behind to the lateral mass, there is a presence of the groove. This groove for the vertebral artery and for the lodgement of the third part of the vertebral artery along with the first cervical nerve. Now we see the lateral mass. The lateral mass has a superior articular facet on the superior surface and inferior articular facet on the inferior surface. Now first of all we see the superior articular facet. It is a concave, oval or kidney shaped, facing upwards, forwards and medially. It's articulate with the corresponding surface of the occipital condyle of the skull and forming the atlanto-occipital joint, which is a ellipsoid variety of synovial joint. Now we see the inferior surface. On the inferior surface there is a presence of the inferior articular facet. This inferior articular facet is articulate with the corresponding surface or the superior articular facet of the axis vertebra and forming the lateral atlanto-axial joint, and it is a flat, circular, directed downwards, backwards and medially. On the medial surface of the lateral mass there is a presence of the tubercle. Now we see the transverse process. The transverse process project laterally from the lateral mass, and unusually it is long, which provides the efficient lever for the rotation of head. It can be felt on the surface of the neck by between the angle of mandible and mastoid process. It is pierced by foramen transversorium. Now we see the attachment on the atlas. So first of all, in anterior aspect, in median anterior tubercle, that is for the anterior longitudinal ligament, and on either side is provide the insertion of upper oblique fibers of longus colli muscles. Then this upper border that is for the anterior atlanto-occipital membrane, and its lower border, that is for the lateral fibers of the anterior longitudinal ligament. Then on the tubercle, on the medial side of the lateral mass, that is for the transverse ligament of atlas. Then on the posterior arch, on the median posterior tubercle, that is for the ligament of Nuki, and on either side there is a origin of the rectus capitis posterior minor. Then this groove, that is for the third part of the vertebral artery along with the first cervical nerve, and the upper border of the posterior arch, that is for the posterior atlanto-occipital membrane, and its inferior border, that is for the highest fibers of the ligamentum flava. Then we see the attachment on the anterior surface of the lateral mass, that is for the rectus capitis anterior muscles. Then we see the on the attachment on the transverse process. So on the upper surface near to the anteriorly, that is for the rectus capitis lateralis, and posteriorly, that is for the that is for the superior oblique muscles here. Then this lateral margin, that is for the levator scapulae muscles, and the inferior surface nearer to tip, that is for the inferior oblique muscles, and the posterior tubercle here, that is for the splenius cervicis, splenius medius, and this foramen transversorium, that is for the second part of the vertebral artery along with the sympathetic plexus and the vertebral vein. So this is about the atlas vertebra. Thank you, students.